Hi, I'm Dr. Paul Reifenrath for Upper Level Canine. I am a veterinarian that has 35 years of clinical experience in small animal surgery and medicine. So I've been retired for a couple of years, but still are active mentoring some young doctors in the general area. So today we're going to talk about environmental allergies, also known as atopic dermatitis in dogs. And this is a very common disease that we see in dogs. Typically it's a young dog disease. We start to see it at about 1 to 2 years of age. And typically these are allergies to environmental allergens. So our pollens, our dust mites, molds, things like that, animal danders. Certain breeds are affected by our allergies. We commonly see our Labrador Retrievers, our Golden Retrievers, Pit Bulls, West Highland White Terriers, German Shepherds, and also we'll see the mixed breeds of these dogs too being affected by our environmental allergies. This is a lifelong disease, so once it starts, it usually needs to be managed for the rest of the dog's life. So we'll talk more about the management as we go along here. The symptoms can be seasonal or non-seasonal. So our seasonal allergies are typically going to be our pollen allergies. So, and usually springtime it's going to be our tree pollens, summertime going to be the grass pollens, and late summer and early fall is going to be our weed pollens, especially ragweed. So this is a disease that's an overreaction of the immune system to these environmental allergens. The symptoms that we see with allergies are going to be generalized skin inflammation, generally in the contact areas of the skin. So the face, the feet, the armpits, the belly, the legs, also around the eyes and the ears. And we're going to have generalized itchiness. We're going to have potential for secondary infections that develop because the skin is damaged from inflammation. Symptoms also can be non-seasonal, and under non-seasonal allergies, they can be allergic to molds, dust mites. They can also have concurrent food allergies, which actually will share very similar symptoms. A lot of our atopic dogs will also have food allergies to mainly chicken or meat proteins. So it's something else that can confuse the picture a little bit when we are presented with an itchy dog. So skin infections play a really important role in the management of allergies. During an allergy flare, the skin becomes very inflamed and we'll get breakdown of the skin, up the oil barrier on the skin surface. And this allows surface bacteria like staph bacteria and or yeast to gain access to the deeper layers of the skin. And when that happens, we get these secondary skin infections, and they can really ramp up the symptoms of itchiness and discomfort. So we need to identify these when they're present and treat them to effectively manage the itch and the discomfort associated with allergies. And this may include topical therapy and or antibiotic therapy. So how do we diagnose allergies? So allergies, typically we diagnose them by their presenting clinical symptoms. We see a young dog, usually a little over a year of age, coming in with itchiness at certain times of the year in spring, summer, or fall. And usually those symptoms will recur the following year at the same time. So we rarely need to allergy test dogs. The only time we allergy test dogs is when we're considering immunotherapy as a treatment choice. So how do we treat allergies? So we treat them best by using what we call multimodal therapy, and that's limiting the access to the allergen. So that would include bathing frequently or avoiding areas where the known allergen is, like along roadsides with ragweed. Also avoiding swimming. We'll talk a little bit more about that later. We also need to treat the itch. We need to treat the secondary skin infections that develop And we can also use immunotherapy to teach the immune system to become less reactive to these allergens. So for our short-term therapy, we typically have a couple different medications that we use. The most common one that was used in the past was steroids or prednisone. Still very effective at controlling symptoms. And we use those mainly for acute severe flares of our allergies with really severe skin inflammation. There are a lot of side effects that can affect certain dogs, so we have to use those carefully and usually taper the dose over time. We also have immune modulating drugs, and these immune modulating drugs are your oral medications like Apoquel or Zenrelia. These are relatively newer medications that are very effective at controlling itch. We also have an injectable medication called Cytopoint that's given every 4 to 8 weeks, and this also can be very effective. Another one we use is cyclosporin. We tend to use cyclosporin when the other immune modulating drugs have failed to control the symptoms. That one takes usually about 4 to 6 weeks to actually gain the effect that we want to see. So we tend to use that as a secondary resort. These drugs can be really expensive, so keep that in mind as we're treating these dogs. Also, immunotherapy is really important. Immunotherapy is actually the only therapy that can change the course of the disease rather than just treating the symptoms. What we're doing is educating the immune system to not respond or respond less to the allergens upon exposure. So with this, it does take about 6 to 12 months for immunotherapy to take effect. So we will use the other medications in conjunction with immunotherapy. So we do see about a 60 to 70% response rate to immunotherapy, and that can really make a big difference in the long run, especially if we have a dog that is allergic to year-round allergens. We have a dog that's allergic to our seasonal pollens and also to dust and dust mites and molds and things like that. Immunotherapy is really an important tool to keep these dogs comfortable on a year-round basis. The other thing that's really, really important with treating our allergies is bathing. Bathing can physically remove the pollens from the skin surface. And that's the main route of exposure that dogs get, is absorbing it right through the skin surface. So if we can limit their exposure by bathing, now we do have to qualify that. If we have a very thickly haired dog like a husky or a Newfoundland or something like that, bathing can be a real challenge. But if we have German Shorthair, Labrador Retriever, bathing can be very effective to decrease their exposure. We also have medicated shampoos that will help restore the oil barrier on the skin surface and also help manage concurrent skin infections. Even simple things like a wipe down with a wet washcloth after they come in from being outside on their legs and their feet and their underside can be really effective at limiting some of their exposure. A few additional tips that we have for our allergic dogs. So if we have a dog that's seasonally allergic, it's really important to be proactive in the management of those allergies. It's best to anticipate when these are going to happen. So if we have a dog that is allergic to ragweed, that first week in August is when things are going to start to happen. So we want to keep that in mind. So we want to start therapy before the symptoms start to develop or when the symptoms are very, very mild. It's really tough to treat an acute flare with an associated skin infection, and also we can save the dog some misery of having to go through those acute flares if we use proactive therapy. I guess what I mean by proactive therapy is using your oral medications or the injectable medication Cytopoint when allergy symptoms are about to begin. Also start bathing at that time as well. Another thought, if our allergic dogs like to swim, that can be a super exposure of these pollens because the wind-blown pollens settle on the surface of the water and dogs jump in and they get coated with this intense exposure of these allergens and they can have very intense allergy symptoms. We'll commonly see very severe ear infections and hot spots, which are really severe localized skin infections, develop after a swimming episode. So it's important to hose your dog down or bathe them after a swimming episode. Keep that in mind if you have a swimming dog. So since this is a lifelong disease and symptoms vary with each individual, it's important to work with your veterinarian and come up with the best plan to manage your dog's allergies over time.